Good morning, I'm Sam Barrow with Tritium. We're presenting today a demonstration of the Smart Hub solution. The NaviCare Smart Hub solution is developed jointly in partnership between Tritium and Hillrom. Tritium having the expertise in the products in the Niagara AX framework, and Hillrom having the expertise in the use space in the medical fields and in hospitals and that sort of thing, where they have many years of experience, and they have clinicians on staff that understand the protocols that are used in hospitals and the types of workflow that occur. So they've helped us develop this product around the framework, the Niagara framework, such that it provides capabilities to hospitals and to their nursing staff to provide better care to patients. The way they provide that better care is to take some functions off the plate of those nurses, away from them, that they typically have to do today, that consume as much as 30% of their time, and allow them to spend that time providing better patient care. The solution consists of a number of components, and those components have to interface into existing hospital systems. So not only do we develop the functionality of each of the individual components of the solution, we have to develop interfaces into existing hospital systems. Examples are the EMR system, which stands for Electronic Medical Record System, and we need to deliver patient data with the patient identification along with that data to that EMR, so that it's archived and recorded for the specific patient that it's associated with. Those steps are currently done in the hospital, but it's manual steps. The nurse has to go to the room, has to chart the readings or write them on a tablet, then has to go to entire rounds where they have many patients to address, then take those readings back to the nurse station and enter them into a data entry station. It takes time to do these things, and it's prone to error. So we're helping with that as well. The other hospital system that this Smart Hub solution does interface to is the ADT system, which stands for Admission, Discharge, and Transfer. Whenever a patient is admitted to a hospital, they've got to have a record put into that system that identifies all their personal information and the room that they're assigned to. And we are interested in the room they're assigned to, because when we're collecting data in a room for patients, we want to assign it to the correct patient as it's routed back to the EMR system. So the solution connects to those two systems as interfaces that currently need to exist in the hospital. The actual components of the Smart Hub solution, there's about a half a dozen of them, start at the highest level with a hub supervisor. The hub supervisor manages all the information about rooms, beds, patients, medical devices, the setup information that can be established for different units within the hospital. They may want to have different protocols for a med-surg area than they would have for a critical care unit. And we allow them to set all that information up and have it automatically apply to those spaces, and it's driven to our other solution components by that hub supervisor. We have a unit called a Biomed Configuration Station, also shortly called a BCS station. It's used by the Biomed IT staff to help them to configure the components so that a hub or a beacon knows what room it is going to be located in, or an MDA, which is our medical device adapter, knows what medical device it's actually attached to. We have a hub that goes in every room. An example right here is our hub that goes into a hospital room. If it's a private room, there'd be one in the room. If it's a semi-private, there might be two. And above or on the same wall as the hub, typically we have what's called a beacon. The beacon actually identifies the room, and the two are paired together. They have a common identifier, so anytime a beacon signal is detected by a medical device, that it can use that information to then locate a hub in the room and begin to pass data to it wirelessly over the infrastructure that we have. So the typical operational scenario is the hub displays data about that the clinician might be interested in. It may have a patient name. I'll press this retrieve button to go retrieve the patient for this room, and it'll actually it'll actually ask me to confirm that that's done, and you can see it displayed the patient name in this case. It retrieved it from the hub supervisor. They got it from the hospital's ADT system. It also identifies the room number and the date and time and a list of devices that are associated with this particular hub. Currently, none are associated. The beacon is just identifying the room and sending out a combination of signals, an RF signal and an ultrasonic signal. MDAs, on the other hand, go on medical devices, and they are searching for a hub to actually associate or bind with. So they're being rolled around in the hallways, brought into rooms, and as they come into the room, they are looking for signals from beacons that are identifying the room identification so that they can bind to the hub. What I have right here is a medical device with an MDA on the mounted on it, and it can be mounted on a bracket on the stand. As you see, this device is on a stand and it's on wheels, and you would roll it into the room, or it might be velcroed to the surface of the device. And the MDA is currently in this search mode. It has a couple of indicators on here. It has an LED right here, the status LED, and it has a low battery LED. Has a couple of buttons, a disassociate button and a capture button, which I'll describe briefly in a moment. And it has this little grill down here in the bottom, and that's where the ultrasonic signal is emitted. And the MDA, as you can see, is flashing green. It's the slow flash, meaning it's searching for a hub to bind to, and that's its objective if it's not bound to bind to a hub. And as it comes into the room and it gets closer and closer and it's calculating its distance from a beacon, it will make the determination it's within the bind range and make a request to the hub to bind. In this case, it's already done that. It typically occurs in 5 to 15 seconds. By that time, it's made that request. Well, it made the request. The hub actually sent that request to the hub supervisor, and the hub supervisor makes a decision and came back down and said, yes, it can bind, but first asked the nurse to confirm that she did bring a Dynamat 300 Pro into the space and that she does intend to attach it to the patient that's displayed on here, Dick Grayson. And he or she would answer yes, and that bind would take place. When that bind takes place, the actual medical device name appears on the device, and an icon with a status color displays here on the screen. It's green here, meaning it is online and collecting data for that patient. So it just routinely now is collecting, and the data is being archived here in the hub. It's being routed from the hub up to the hub supervisor, and it's sending it to the hospital's EMR system for recording, and the nurse did not have to do any of those steps, didn't have to come to the room and chart the data, didn't have to take it back out to a workstation and enter it in. The data is just automatically being collected and routed back to the EMR system, which is the primary objective of the solution. And all of this functionality, all the work at the hub, our other components in the other spaces, the hub supervisor, the biomed configuration station, the MDA, they're all based on the Niagara AX framework and the capabilities that it has. In conclusion, you've seen here today the Smart Hub solution, presentation of the architecture and a demonstration of the functionality of several of the components. The entire solution developed by Tritium in partnership with Hill-Rom, and based on Tritium's Niagara framework, presents a new product for the market that the market has shown an interest in obtaining and using, and I think it'll be a very successful product in the marketplace today. Thank you for your time.